Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself, and the Chief Medical Officer, Executive Vice President of the nonprofit CLL Society. And I'm going to be talking about some of the most important papers for CLL patients presented at the European Hematology Association in 2024. Now I'm going to be talking about an oral abstract called Single Agent Epcoritamab leads to deep responses in patients with Richter's transformation, primary results from the Epcor CLL-1 trial. And as always, I'm going to start with the bottom line. Epcoritamab, a bispecific antibody, led to a 50% overall and 35% complete response rate in all Richter's transformation patients. This research was presented by Dr. Arnon Kater from the University of Amsterdam in the Netherlands, who gave an oral presentation on the last day of the European Hematology Association annual meeting, or EHA 2024 in Madrid, on behalf of an international coalition of researchers who looked at using this novel agent for Richter's transformation. Let's get into the background. Richter's transformation, RT, or Richter's disease, is when chronic lymphocytic leukemia, or CLL, transforms into a more aggressive lymphoma, which is usually a CD20 positive diffuse large B-cell lymphoma. CD20 positive means that it has this protein marker on its surface. Richter's transformation carries a dismal prognosis with complete response rates of less than 20% with conventional and even most novel therapies. Epcoritamab is a subcutaneous CD3 and CD20 bispecific antibody. In other words, it attaches to those two different kinds of cells. The CD3 are found on the T cells, which are then pulled in the direction of the CD20, which is found on the cancerous Richter cells. It's already approved for treatment of different subtypes of relapsed or refractory diffuse large B cells after having received 2 or more systemic treatments in various countries around the world. It's a powerful immunotherapy that engages the T cells and directs them to attack any and all CD20 cells, including CD20 positive Richter cells. This data that was presented was from the ongoing phase 1b/2 Epcoritamab CLL-1 trial, and it's assessing the safety and efficacy of epcoritamab in CLL and Richter's transformation. What I'm going to be talking about was the first data that was presented from a larger follow-up in the Richter's transformation cohort. So who was studied and what was the method? To qualify for the trial, you had to be an adult with biopsy-proven CD20 positive diffuse large B-cell lymphoma and a prior history of CLL or small lymphocytic lymphoma. You had to have received 2 or less prior therapies for the Richter's transformation. Patients received epcoritamab after being ramped up at 48 milligrams and 28 cycles until the disease progressed. Step-up dosing and steroids were used to lower the risk of cytokine release syndrome, and this is when there's a rapid killing of the cells, which leads to release of cytokines, which are inflammatory enzymes that can cause severe adverse events. That's seen with any immunotherapy, and epcoritamab was no exception. This is similar to the CRS seen with CAR-T that also involves activated T cells. So let's look at the results. 35 patients with Richter's transformation have received epcoritamab. A total of 91% had received 1 or more prior therapies for their CLL or their Richters. 49% had received prior treatment for their Richters. Most of the patients, the treatment, 57%, was a Bruton tyrosine kinase or B-cell lymphoma T BCL2 inhibitor prior to transformation, as we'd expect in today's treatments. The most common treatment for the Richters was an anti-CD20 monoclonal antibody combined with a chemoimmunotherapy, so things like R-CHOP. That's what 3 out of 4 patients got. Let's take a look at the adverse events. The most common adverse event occurring in 4 to 5 patients was the cytokine release syndrome, or CRS. Low platelet counts and anemia were seen in 40% of the patients at baseline and in 40 and 34% patients respectively as the trial went on. Cytokine release syndrome was most common after the first full dose. Remember, there was a slow ramp up, and most were low grade, but one patient had a more severe or grade 3 cytokine release syndrome. 4 patients had what's called ICANS, which is a neurotoxicity. All of these patients also had CRS, and all of them recovered. Clinical tumor lysis syndrome, which is where there's a rapid killing of the cells, which leads to toxicities, occurred in 3 patients. No CRS, ICANS, or cytokine release or tumor lysis syndrome led to treatment discontinuation. But sadly, 2 patients discontinued treatment because of adverse events, and 3 patients had fatal treatment-related adverse events. One was just a general physical deterioration in 2, and sepsis in 1. Let's look at the responses. 13 patients, or 37%, are still receiving epcoritamab. In those where their responses could be evaluated, which was 26 patients, the overall response rate was 50%, and the complete response rate was 35%. For those where epcoritamab was their first treatment for Richter's transformation, the overall response rate jumped up to 62%, and the complete response rate was an encouraging 54%. Responses came quickly. Time to complete response was 2.4 months, and time to just any response was 1.4 months, very fast. An estimated 53% of patients with a complete response were still had a complete response 9 months out. And that number jumped up to 75% if they'd had no prior treatment for their Richter's transformation. So let's discuss this and make some conclusions. With half of the patients responding and over a third reaching a complete response, with more than half of those still in remission 9 months later, these are encouraging results in a disease where most patients don't live longer than a year. The results are even better when it's used as a frontline therapy, suggesting future ethical trial design should allow its use without forcing patients to fail a toxic and usually ineffective chemoimmunotherapy. It's early, but appropriate dosing and ramp up, more stringent CRS prophylaxis, and possible combinations with other medications to enhance its efficacy should be part of research in the future. This is a potent immunotherapy. It's not easy and it's not without its risks, but it can usually be managed in what is usually a quickly fatal disease. On the website, we provide a link for you to read the actual article and look at the tables by clicking on Single-Agent Epcoritamab Leads to Deep Results in Patients with Richter's Transformation, Primary Results from the EPCOR-CLL-1 Trial. Thanks for listening. Stay strong. We are all in this together.